Hi, and welcome to our very first week one, lesson one, understanding autoimmune diseases. So I'm very glad that you are here today. And in this first lesson, we're going to explore just what autoimmune diseases are and how they impact not just your body, but your whole life experience. So my goal is to help you feel more empowered, more informed, and most importantly, more in control of your own health journey. So let's dive right in. So let's start with a foundational question of what exactly is autoimmune disease? Well, to begin, they are among the greatest unsolved mysteries of the medical profession. Most are considered idiopathic in nature, which simply means of unknown origin, or in other words, we don't really know where it comes from. But here's what we do know about it. Think of your immune system like your body's personal security team. It's designed to defend you from harmful invaders like bacteria and viruses. But in autoimmune diseases, this defense system goes off track. It gets really confused and it starts attacking your own healthy cells. The result is, of course, inflammation, tissue damage, and a variety of symptoms depending on where the attack is focused. So there are around 80 to 150 different known autoimmune diseases affecting various parts of the body. And these range from common conditions like rheumatoid arthritis, psoriasis, and type 1 diabetes to some of the more rare ones. The exact causes of autoimmune disease is not well understood at all, but they are believed to involve a combination of genetic predispositions, or more specifically, epigenetics, which we're going to talk a lot more about later on in this program. But it's a mixture of epigenetics, environmental triggers such as infections and toxins, and of course, lifestyle factors such as diet, stress, and sleep. So we're going to cover all of this a lot more as we continue to go along. Okay, autoimmune diseases are quite common, affecting about 8% of the US population, which, if you break that down, is about 1 in 13 people. And that's according to a very recent study done in 2025. However, some studies suggest this number could actually be quite a bit higher, with estimates more around 10% of the population being affected. Women are disproportionately affected by autoimmune diseases, accounting for about 63% of those diagnosed. And this is particularly true during our childbearing years. There is lots of evidence suggesting that the incidence of autoimmune diseases is rising all over the globe. For example, the prevalence of anti-nuclear antibodies, which is a marker of autoimmunity, has nearly doubled between 1988 and 2012. Co-occurrence is also very common, meaning individuals with one autoimmune disease have a much higher risk of developing another one. The immune system is very highly sensitive to stress. So chronic trauma, which involves prolonged and intense stress, can significantly disrupt normal immune functioning. Trauma can lead to the long-term activation of the body's stress response, resulting in chronic inflammation. And as we know, inflammation is the root of all disease and certainly a key factor in the development and progression of autoimmune diseases. There's also a lot to do with our gut. Trauma and chronic stress can impact the gut microbiome, which plays a crucial role in immune regulation. Alterations in gut bacteria have been linked to an increased risk of all autoimmune diseases. So let's summarize what we've covered so far. Your immune system is incredibly powerful. In fact, it is made up of more than 1 trillion immune cells that are constantly on patrol. When things go well and it identifies what belongs and what doesn't, no problem. But in autoimmune disease, it loses that clarity and begins to treat your own body as if it were the enemy. This immune misfire is at the heart of every autoimmune condition. So let's talk a little bit about some specific types of autoimmune conditions, just so we can kind of see some of the similarities and differences between these. First up is rheumatoid arthritis. In this condition, the immune system goes after the lining of your joints, and that can cause intense pain, swelling, and stiffness, and over time, severe joint damage. It affects about 1.3 million Americans. Next is lupus or systematic lupus erythematosus, which is quite the mouthful. But this is a complex condition that can impact multiple systems in the body, including skin, joints, kidneys, and even the brain. Symptoms tend to come in flares, which can make it very tricky to diagnose. Interestingly, there are about 90% of people that are, about 90% of people who are diagnosed with lupus are women, so very disproportionately affecting women. Hashimoto's is another common autoimmune disorder. It targets the thyroid gland, which plays a huge role in energy and metabolism. People with Hashimoto's often deal with fatigue, weight gain, and a sensitivity to the cold. And this is actually the most common cause of an underactive thyroid in the United States. In type 1 diabetes, the immune system destroys the insulin producing cells in the pancreas. And without insulin, your body can't properly regulate blood sugar, which of course affects your energy, organ function, and long term health. About 1.6 million Americans live with type 1 diabetes, and most of them were diagnosed with it in childhood. So, what makes autoimmune diseases even more challenging is that many of them, like the ones we just discussed, share similar symptoms. And you might experience fatigue that doesn't go away, joint or muscle pain, digestive problems, or brain fog. Skin rashes or flares can also appear with certain conditions. And of course, these symptoms can be hugely frustrating, especially when they come and go and are not immediately visible to others.
So, beyond the physical effects, autoimmune conditions can deeply impact your quality of life. If you are here, I know I'm not telling you anything you don't know. You're likely very familiar with this part of the condition where it really affects your ability to function normally day to day. And that can include emotional and social isolation, feeling very misunderstood and invalidated by friends and family and even doctors. Treatments that just don't work, nothing seems to help. You go and have your labs done and they say everything looks good, or they've done as much as they can to manage this. I'm sure a lot of you have heard that numerous times, despite the fact that your symptoms are not improving. There's also a lot of diagnostic delays and challenges. Many people face years of delayed diagnosis or even doubt their own experiences because this goes on for so long. In fact, studies show the average time to diagnosis is about 4.5 years. And this is often because the root of the issue, what's actually causing the inflammation, has more to do with the nervous system dysregulation, epigenetics, and past experiences than it does with the symptoms that are currently presenting. So that's why it's so important that you are here and you're willing to do this work on this self-healing journey to dig a little deeper and recognize that the issues you are dealing with today could be the result of a lifetime of self-suppression, excessive concern for social acceptability, and chronic dysregulation. And you deserve better. This is no way to live. And I want to help you get there. Most healthcare providers are trained to focus on biological symptoms. That's blood tests, inflammation markers, organ function. And while that's all well and good and essential, it often misses the deeper psychoneuroimmunological links. The way that long-term emotional distress and unresolved trauma and nervous system dysregulation quietly shape how your immune system behaves, something that's often overlooked. Many patients with autoimmune disorders, especially women, report long histories of childhood neglect or abuse, high functioning anxiety or hyperindependence, unprocessed grief or complex PTSD, Caregiving burnout is a really big one, or perfectionism, thinking under chronic pressure. This is something I have seen over and over in my clinical setting. And, over time, this type of trauma keeps the body in a constant state of threat, activating your sympathetic nervous system, which is the fight or flight response, and suppressing healthy immune regulation. This, in turn, creates chronic inflammation, cellular confusion, and ultimately misdirected immune responses, which are all hallmarks of autoimmune disease. Yet, here's the big problem. Most providers are going to ask you, what's wrong with you, right? What are your presenting symptoms? They are not going to ask you, what happened to you? What is your past like? What traumas have you experienced? And that's why I'm so passionate about this work. That's what I'm here to do, is to change that and to empower you to take control of your health through creating a better understanding of what's actually causing symptoms and how you can manage them and or alleviate them altogether, and ultimately stop allowing autoimmune symptoms to control your life. So I like to end each of our lessons with some journaling prompts to help you dig a little deeper into what we talked about today and reflect on how these topics uniquely apply to you. Each lesson will have a companion worksheet, which you can find in the module under week 1, lesson 1, or whatever week we're in. I really encourage you to go in and fill out those Google documents, or you can print them out and do them by hand, whatever you prefer. But please take the time to do it. It's really important to your progress and your ability to connect with your true self and your true feelings and beliefs, which is going to be vital to our work going forward. So don't forget to check that out. So I'd also like to leave you with a quote by one of my favorite authors, Dr. Gabor Mate, who is a world-renowned physician specializing in addiction, stress, and trauma-informed behavioral health. And he said, "Health and illness are not random states in a particular body or body part. They are, in fact, an expression of an entire life lived, one that cannot, in turn, be understood in isolation. It is influenced by, or better yet, it arises from, a web of circumstances, relationships, events, and experiences." And I really love that quote because I think it summarizes things beautifully. That, in short, if we truly want to help people heal, we've got to stop treating autoimmune symptoms in isolation and begin looking at the whole person, including their story, their stress patterns, emotional pain, and their lived experiences and their current experiences and stressors. So I hope you found this helpful. Thank you so much for showing up for yourself today and for joining me today. I am very much looking forward to continuing our journey together, and I'm going to look forward to seeing you in lesson 2. See you soon.